The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified Podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified Podcast.
Welcome, everyone. Glad you're here. Welcome to the next episode of TMD Demystified. I am Tony Urbanek. Today's episode is a little sensitive in nature. I, as always, question whether or not some of these things I should make videos on, topics that may have a problem, create a problem with other people, with other patients, with other doctors, with other providers. And this is one that I thought of in some depth, and it wasn't hard to decide to do it. I just have to, on the front end, kind of apologize for how this might sound, because my intention is to help. My intention is to, first of all, help patients. My intention is to bring excellent care for patients who have temporomandibular joint disorder, singular disorder. It's one disorder, not a bunch of disorders. And to help my fellow doctors, both dentists and physicians, because again, I am both a dentist and physician, licensed in both professions in Middle Tennessee and Tennessee, licensed in Tennessee, trained at Vanderbilt, dental school at Indiana, medical school at Vanderbilt. And well, let's just get on with the title. The title of this episode is Medical Providers State-of-the-Art TMD Diagnostic Skills. The diagnostic skills of medical providers for the issue or the problem of TMD. As a spoiler alert, let me just make it really clear. The point that I'm going to be driving toward is the diagnostic skills for medical providers for diagnosis of TMD are terrible. They're slim to none. They're frankly almost non-existent, unfortunately. And I don't say that to self-aggrandize myself. I don't say that to sound critical. I don't say that without a lot of data and a tremendous amount of experience that coincides with not just my experience, with the experience of any provider of any kind that tries to deal with patients with temporomandibular joint disease. My dental providers are not a whole lot better. And I've talked on that many times, but today we're just speaking of medical providers, and here's how it came to be. Here's how this episode came to be titled and why I bring it to your attention. With my intention is to try to solve this problem, not just to criticize or just not to complain or bring the problem to your attention, but to make it known that there is a solution to enlightening our medical providers, and I'll bring that out at the end, hopefully, for your benefit and enlightenment. But it all started just this week when my associate came into my office where I'm sitting now, and I always provide these episodes on a Tuesday. So today is June 17th, 2025, Tuesday. And my associate came in the office. He said, would you mind if I came in and vented about something, relieve my mind on something a little bit? I said, sure, come in. It's what happens when you have an associate in the office. You can share information and vent if you'd like. And I said, what's the problem? And he says, well, I just walked out of a consultation with a patient who had obvious TMD symptoms, had all or most of the symptoms, had very positive X-ray, which is a simple Panorex, which showed significant degeneration or damage to the temporomandibular joint, and a positive physical examination. He said she had obvious TMD. He says that wasn't the problem. The problem was the history she shared with me of her previous experience within the medical community, within the medical profession, trying to come up with a solution for her problem. I said, well, what exactly was that? He said, what she said was that she had started out with her PCP complaining of earache, ended up with an ENT doctor who did a very expensive, very extensive examination for ear pain, including an MRI, which showed the MRI was negative for any kind of problem. His physical examination was negative. He couldn't find any reason why she was having ear pain. ENT is very able to diagnose ear infections, earaches. And he said, you don't have an ear infection. I see no reason why you should be having ear pain. And our workup shows that there's nothing here that we can hang on to make a diagnosis. And the patient again shared and asked the ENT, ear, nose, and throat otolaryngologist, well, what is available? What possibly could this be other than an ear infection and the differential diagnosis? And his answer was, well, if it's not an ear infection, it's possibly shingles of the ear. Beyond that, it might be Bell's palsy. And the third option is you're just crazy. Told the patient that. And the patient was relatively medically aware, according to what my associate told me, and said, none of those make sense. And it's true. None of those diseases, shingles, Bell's palsy, have anything to do with facial pain, ear pain, nothing. She said, none of this makes sense. And then finally he said, well, I'll tell you what. He says, I'll refer you to a neurologist and let the neurologist use some Botox, which, of course, we all know now Botox is the latest and greatest, and I've already talked about Botox being basically the same as injecting saline into a muscle, getting the same reaction. And that has been proven scientifically on an article, which was published in the January edition of a Journal of Oral and Maxillofacial Surgery. Look it up if you'd like. But the patient was extremely, during her history part of my associate's consultation, was very upset about this. And then as he and I always do, we go through the examination history, physical examination, and then we explain to the patient not only what the solution is and why there is a solution, but exactly how that all relates to the symptoms, how the symptoms are created by inflammation within the joint, and how ear pain, feeling of earache, is created by inflammation within the temporomandibular joint, how headaches and jaw pain is created directly by inflammation within the joint, and explains how that happens literally, physically, physiologically, mechanically. And at that point, he shared with me, and the patient began to cry with relief that finally someone had a explanation that made sense, because he and I both take an elaborate amount of time explaining to patients exactly how inflammation within this joint, created by the three causes of inflammation within the temporomandibular joint, how those three causes create damage, and damage creates inflammation, and inflammation creates all the symptoms. And then describing to the patient the symptoms that they're aware of. And then usually they have several symptoms that they know they have, but totally have no relationship in their mind to inflammation in the joint, like upper back and shoulder pain, which is upper back and shoulder pain and neck pain are the second most common symptom of TMD. The second most common symptom, first being headache. Earache is either third or fourth. And some of the most wild one is arm, hand, finger tingling and numbness is related to inflammation within the temporomandibular joint. And I've explained multiple times how that occurs, why that is, why the muscles, when they get signals to tighten up, autonomic nervous system, sympathetic portion, tighten up, don't move that joint, don't move the joint. When help you heal, and they, in the neck, squeeze the brachial plexus, and when the brachial plexus is squeezed, it creates arm, hand, finger tingling and numbness, a direct symptom of inflammation within the temporomandibular joint. It's wild, admittedly, but true. Anyway, and that's why we keep a box of Kleenex in all of our examination rooms, because it happens so often. Now, getting back to this particular ENT doctor, I am not even trying to fault this one particular doctor, because I worked elbow to elbow, both in dental school and specifically in my medical training in medical school, and very much in my oral and maxillofacial training, internship, residency, elbow to elbow with all the different medical specialties and my medical colleagues. And I know how difficult their training was, because I did it. We shared that, and I know how they think. We've shared, thousands of conversations with my medical colleagues. They're not dumb. They have very, very good intentions. The problem with the medical community, starting with the MDs, medical doctors, and the different parts of that profession, general medical doctors, PCPs, specialists, ENTs in particular, who deal with a lot of ear pain and jaw pain, Meniere's disease, ringing fullness, dizziness. They're well-intentioned, but they're biased. They're biased by their training. And I promise you that in medical school and in surgical training as an ENT doctor, you get zero experience with TMD. One way or another, it is always pushed off on the dentist, and the dental schools don't train about it. They know little to nothing about it, each dental school of the 100 or so dental schools in the country. But back to the medical colleagues, I support them. I don't say this to criticize them. I say it because of their bias. They have pretty much tunnel vision as to how they were trained. They have no experience in TMD. And it's a shame for the patients, because when you have some of these symptoms and you go to and you're locked into the system, you're going to see your PCP, who is going to then triage you. If he feels he cannot treat it adequately, one way or another, he will triage you to one of the specialties, whatever specialty he thinks is best, unless he recognizes that actually he's dealing with a temporomandibular joint problem. And so the patient is at the disadvantage, and it rolls down the hill into the nurse practitioners and the physician's assistants, who more often than not, and more likely than not, currently are doing the groundwork in examination and history for their physician compatriots, and they know less than the physicians about TMD. And how do I know that? Because I've lectured. I've spent several times lecturing physician assistant groups in both Tennessee and Missouri, nurse practitioner groups, large groups. And when queried about what they know about TMD before my lecture, is like zero, nothing. So the problem with the medical profession is they're not exposed to any of it. They have no idea. The only thing they know, if there's a suspicion that it is TMD, then it's go to your dentist. And not any particular dentist. Because they don't know who to send it to. They just figure the dentists are supposed to be taking care of this. And as I've said hundreds of times in these episodes, because I am now doing episode number 206, so I can honestly say hundreds of episodes, 206 episodes, and specifically, half of the dentists don't want anything to know about TMD because they think it's complicated, because they think that there is no answer to the problem, and they don't want anything to do with it. And the other 50% or 49.9% of dentists make a night guard, give it to the patient, and hope the patient does not come back. And then there's 1/10 of 1% that consider themselves TMD gurus in dentistry who try to game the medical insurance companies to pay for their nonsense. And it is nonsense. And I stick by it. And to this date, I've said this hundreds of times within these podcast episodes. So at least half of the time, I say I'm welcome to criticism. I'm open to criticism, but please, if you want to criticize, bring your data, bring your data that proves, bring your proof of what you have to say. After now almost 4 years, I have not had a single response from anyone generated out of these podcasts who wants to criticize anything I've said. I'm surprised about that. I'm not looking to be criticized, but I'm open for criticism. I could be wrong, and I'm happy to correct my wrongness if someone wants to bring it to my attention. Please do bring it to my attention where I'm wrong. But I am not wrong much. My wife would disagree with that, maybe. But regarding the state of the art of the medical profession and the diagnosis of TMD, it is almost non-existent, unfortunately. And that was brought to my attention again by my associate, but we see it almost daily in our very large practice of limited to treating TMD here in Middle Tennessee. That's all we do, is treat TMD non-surgically using a very simple device that unloads the joint adequately according to the protocol, that relieves the symptoms by decreasing inflammation to the point where inflammation no longer drives all the symptoms. The solution is the following. I promised you a solution, and for anyone listening, if you are a dentist, this will be very meaningful, hopefully. If you're a physician, you may get a letter or note from a local dentist in your locality eventually about this. But the solution is the following. Every time that we, as a practice, are in the middle of treating a patient, a letter is sent to all of that patient's doctors, whether they be current doctors or past doctors. We always ask for a doctor list of all the doctors that they can recall in their list. And I mean all doctors, not only their PCP or the physician that referred them in, or the dentist or their oral surgeon, but everyone, their ENT, their chiropractor, the last nurse practitioner they saw at the walk-in clinic, everyone that they can come up with. And a letter is generated to that provider of record that has seen that patient for one reason or another, whether it be a TMD symptom or not. And a letter is sent out every time that patient comes in at diagnosis, consultation, delivery of the device, beginning of treatment, and every follow-up time the patient is in the office, describing what the symptoms of that patient are, listing the symptoms, and what level of symptom relief that patient now has at any particular point in time. As an example, your patient Molly was in today now 3 weeks after beginning treatment with the device and protocol, and states that 70% of her symptoms are now diminished or decreased. Those letters that fall into the hands of the medical providers of that patient eventually get the attention of that provider that they misdiagnosed the problem or didn't diagnose the problem, had no idea what it was, but now is found out to be TMD. And using that method, very simple, snail mail, a little paper, a computer, and those letters are generated. And we now have a great number. Actually, we know what the number is, over 900 referral sources, a third of them being out of the medical profession, 2/3 out of the dental profession, and 1/3 of those 900 plus referral sources for temporomandibular joint disorder come from the medical profession in Middle Tennessee and growing rapidly. I see names on a weekly basis. I've never heard of these doctors. I don't know them personally. I've actually never heard of them in practice, but they send patients because of those letters and they realize that they made a misdiagnosis. So it's all about education. We cannot rely on the medical schools and dental schools to educate about TMD. I think that is my primary point about this episode, regarding this episode, why I did it. We cannot rely on the dental schools in particular. They're not doing it. And the medical schools, it's not in their wheelhouse to educate about TMD, although it is very, very common. When you add all of the symptoms that are associated with TMD, and I mean all of them, not the usual just earaches and jaw pain, but the headaches, earaches, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, which is Meniere's disease, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking of various kinds of jaw locking issues. When you add all of those together, it adds up to almost 45% of the female population. Why is it a female population? Because estrogen, the female hormone, exacerbates inflammation, and inflammation drives all the symptoms. That's why 90% of patients who have TMD are females, 10% are males. It's almost exclusively a female disease. All right, a lot of information today, but the take-home message is, unfortunately, I respect my medical colleagues, but unfortunately, they are not educated to diagnose TMD even close. They have bias, even the ones who should be able to be familiar with TMD, which would be the ENT doctors. And I have a lot of friends that are ENT doctors, and we have a lot of ENT practices and ENT doctors out of Middle Tennessee who send us patients, but they have been educated by experience, starting out with those letters, and then they get a constant stream of those letters back to them as to, once they refer a patient in, how well that patient is doing with those symptoms. And so that is the solution. It's kind of a DIY educational system on the topic of TMD. It is successful. I would recommend it to others highly. If you are a dentist who would like to join our network of doctors throughout the United States who treat TMD non-surgically using a very simple device that works with a very simple protocol, it is a patented device. It is FDA cleared. We have our own FDA approved manufacturing facility that makes these things for doctors now throughout the United States. Actually, we're into 18 states and growing. You can contact us and get into the educational part of this at www.urbanektmj.com. Anyone who'd like to talk with me personally, I'm available at Tony at tmjservices.net. I hope I've expressed myself clearly. I hope I haven't insulted anyone. I have not intended to insult the ENT profession or specialty at all. A lot of these guys are my buddies. But unless you're educated, unless you're familiar, unless you take your biases away, it's likely that you will miss the diagnosis. And I just gave you an example today of one of literally thousands that we have seen here in this practice in Middle Tennessee. I look forward to the next time that I'm able to speak with you, that you show up. I hope what I have to say is meaningful and helpful to you, your practice, and especially your patients. I am Tony Urbanek, and this is TMD Demystified.